Alright, in part two of this lecture, we'll start off with preventing heat illnesses. Some of the things to note are dehydration. You don't have to rely on thirst to note when you're dehydrated. At 2% of normal body weight, that's a lot. Like if you're losing 2% of your body weight. Fluid and electrolyte replacement. For the most part, sports drinks are going to cover all of your bases in preventing heat illnesses because you'll get fluids and you'll get the electrolytes needed to maintain that balance in your blood. And then also acclimatization, um, giving yourself 7 to 10 days to um, work your way up to a higher intensity of training is optimal. And that's not always possible, but as many days as you can get to slowly increase the intensity, the better. In our next slide, we see some other tips on how to prevent heat illnesses. One is to identify susceptible individuals, so kids who have larger muscle mass or are overweight. Um, Also, selecting appropriate uniforms, making sure that you're not training in gear that's going to trap a lot of heat. Also, maintaining weight records um, so that you're weighing your athletes before and after practices. It says they should lose less than 3 to 5% of their body weight. Also, temperature and humidity readings, like as we noted before, that's what our sling psychrometer is used for. And going back to the first point of identifying susceptible individuals, now the NCAA mandates that every student athlete gets tested for the sickle cell trait because those athletes are going to be more susceptible to acute exertional rhabdomyolysis. So, in making sure that you have a list of people uh, who are testing positive for that is going to be vital because you can adjust the way that they're training and make sure that they're seeing their doctor on a regular basis. All right, so now we switch gears and we're going to talk about hypothermia. So just some things to note here, as far as temperatures decreasing, um, and also body temperature decreasing to athlete inactivity. And one of the other things is damp or wet clothing. So depending on the sport that your athletes are participating in, these are some things that you have to note, especially just having wet clothing. Um, that's something that doesn't allow your body to warm up. Also, it says heat loss to environment may exceed body's metabolic heat production. It says shivering could cease at body temperatures of or core body temperatures of 85 to 90 degrees Fahrenheit. And some other numbers to note is that your death could be caused at core body temperatures of 77 to 85 degrees Fahrenheit. Here are some common cold injuries. One of the first ones are frostnip, where it usually feel this in the ears, nose, cheeks, chin, fingers, and toes. So basically, the most outer parts of your body, the most outer extremities. Um, it says you can have firm, cold skin, and it doesn't always have to blister. Um, Firm, sustained pressure, warm breath, or place hands in your armpit. So just some ways to decrease the symptoms of frostnip. The next injury is frostbite. So this is where you're exposed for a longer period of time to very cold conditions, and you'll note that the your extremities will be cold, hard, pale white, and you'll initially feel numbness. And superficially, the skin it'll affect the skin and subcutaneous tissue. Um, as a person tries to rewarm themselves, they will feel a sensation of burning, stinging, um, and as the frostbite gets deeper, this will turn into a medical emergency. And the typical temperature that you want to rewarm somebody, so let's say someone has been outdoors for a long time, and you notice that they're starting to have these symptoms, you want to rewarm them in water that's at a temperature from 100 to 110 degrees Fahrenheit. The next environmental consideration is altitude. So here we talk about um, what could you may have heard is called altitude mountain sickness, and a lot of athletes will experience this because they're usually not going to high altitude um, with enough time to adjust and to reap the benefits of adaptation. So they're going to experience a decrease in maximum oxygen uptake. So as you breathe in the air, um, you're not going to be able to um, extract the oxygen from the air to go into your blood, which then should go to your muscles. It doesn't happen as easy um, at high altitudes than it is at sea level. So that's why it feels or more difficult to breathe, like you're not getting enough oxygen. So what your body decides to do in response to that is increase your heart rate. So it tries to pump more blood to all the muscles, and that's done by increasing how fast your heart is pumping, which is your heart rate. The other thing that may occur is hyperventilation. So your body says, I'm not getting enough oxygen, so I'll breathe faster. And that's what hyperventilation is. And that could actually make the situation worse. Some adaptations that happen at altitude are larger chest capacity, more alveoli, more capillaries, and more red blood cells. However, this doesn't happen over a period of 2 or 3 days. This usually takes several weeks, even months. So it says residents or extended visitors may make partial adaptations, but for the most part, anyone who's just going to a higher altitude competition is not going to be there for that long, and they're not going to be able to reap these benefits. So, what do you do in that case? The main things are to hydrate as much as possible, get as much sleep as possible, and just kind of be aware that initially when they start exercising, it's not going to feel very comfortable, and they may have to take longer breaks in between their training sessions. So here's more details of altitude mountain sickness. It says tissue, excuse me, tissue disruption in brain causing sodium and potassium imbalance, sleep disturbances, dyspnea, headache, and nausea. So all these things are associated with altitude mountain sickness, and just some things to just be aware of as your athletes travel to higher altitudes. Um, Another problem that could develop is pulmonary edema, which is fluid in your lungs, and some other symptoms are dyspnea or trouble breathing, coughing, headache, weakness, and loss of consciousness. Again, here we see the sickle cell trait uh, um, disease, and how going up in altitude could trigger some problems for the carriers of this disease. It says red blood cells become deoxygenated and clumped together, and this may cause an enlarged spleen, which makes it a lot easier for a spleen to to become lacerated, especially for contact sports. All right, so the last environmental consideration we'll talk about is lightning. And here we talk about lightning safety. So if you're in an area or you live in an area where lightning storms are very common, an EAP should be developed. So an emergency action plan should be in place. There should be a protocol of how to determine when to leave an outdoor event and when it is safe to return to that event. Um, Usually for areas like that, there's going to be lightning detectors. It says they can monitor storms within 40 miles, and there's also websites that will help you detect that type of activity. some lightning safety. There's a quick measurement of how far lightning will be, so flash to bang, which is you count the seconds between the time you see the flash of lightning to when you hear the bang of when it's hitting, and you divide that measurement of time by 5. So if you have a 30-second count, that means that the thunderstorm is about 6 miles away. So for the most part, anytime you count 30 seconds or less between the flash and the bang, then the field has to be evacuated and have all student athletes and all the fans move indoors, just to make sure that no one gets struck by lightning. And some of the things you want to avoid are trees, metal poles, objects, hills, water, and phone lines. Um, and you go from you try to get to the safest facility as possible. If there's no indoor facilities very close, then the next best thing would be just to stay inside your car if you're in a car, if you've driven there. A natural warning, so something that can be that people have sensed before lightning's going to hit somewhere nearby them, is that the hairs on their back or their arm will stand up, and that's somewhat of a natural warning. So just some notes on safe locations for when lightning is going to strike. Um, you want it to be an enclosed area, building preferably, and you don't want to be next to any trees. You want to avoid being outdoors at all costs. It says it is important not to be connected to these pathways while inside the structure during ongoing thunderstorms. It says a secondary choice for a safer location from the lightning hazard is a fully enclosed vehicle. So like I mentioned before, you want to be in a fully enclosed vehicle, not like a golf cart or a motorcycle or anything like that. It says it is important not to touch any part of the medical framework. So just, you would try to, just kind of wait it out in your car and making sure you're not touching anything that's metal. It says avoid being in contact with or in proximity to the highest point of an open field. So no hills, anything like that is definitely somewhere you don't want to be. So here's the flash to bang count, like I mentioned before. And again, if it's within 6 miles, you're going to postpone or suspend the activity. And it says signs of imminent thunderstorm activity are darkening clouds, high winds, and thunder or lightning activity. So once you've suspended activity, when is it safe to go back? So, based on what most people have done in the past, you should wait at least 30 minutes after the last sound of thunder or lightning flash before you resume activity. So someone should be recording how much time has passed, and then let everyone know if it's safe to go back outdoors. If that 30 minutes, or if you don't go 30 minutes without lightning activity, then for most activities they should just be suspended. Make sure that no one is put in danger of being struck by lightning.